Greetings, everyone. Career success in anything really depends on two factors. Is it doable? Is it viable? And today we have all those answers for you with someone who's done it all, Dr. Bhuvan. So you better remain seated and keep watching till we get there. With a few housekeeping information to begin with. So, first and foremost, or let me begin by saying I'm Dr. Mandana Donahue. I'm the founder of Oral Pathology 360, the channel that was started basically to promote oral pathology, but has become so much more since then. Nonetheless, oral pathology does remain the main focus. Now, with the other information that I'm supposed to share, of course, last week itself, I showed that we have reached the limit. The channel, I'm happy to say, has reached the limit where YouTube allows us to collect funds from those who watch it and who enjoy the content. Now, this is in the form of what they call super thanks and super chat. Both of these things basically enable those who enjoy the content to contribute. And if it is during the live chat, as you can right now see, I think Dr. Nasser has already contributed today, and you can see this cute looking sticker there. So thank you, Dr. Nasser. And that is what anyone can do to the amount that you want. It is a one time contribution. It will help us in meeting all the expenses of the channel that include all the hardware, the software, the programs, the internet, the time, the artwork. I mean, it's a big list, but it helps us to keep going. And if you do it during the live stream, it's a super chat. If you do it while watching any of the content that is already on the channel, it is super thanks. How you find it is by looking for that dollar sign. And we announced this last week, and I'm also very glad to say we had a contribution last week itself from Dr. Divya Upala. Thank you so much for your contribution. She put in a super thanks on one of the episodes that were there. Another thing is to tell you about how the program flows, and that is with so basically, what we have is, if you have not been here before, so we have the discussion, and you will be able to put in your thoughts and comments and questions in the live chat, and then we will answer them. We will bring them on the screen so everyone can see them, and we will answer them. This can be during or at the end of the discussion. Of course, to safeguard everybody and to avoid having spammers who can crash the site, I have had to enable subscription. So what that means is that, and it's a free subscription, you just have to hit the subscribe button, be subscribed to the channel, and 1 minute after your subscription, you can start posting on the channel. And of course, if you're already subscribed, exceptional. Now, going with today's program, let's not delay anymore. So today with us, we have Dr. Bhuvan Nagpal from his rather long list of things he has achieved in life. You can see he is very with it and very successful. He is the lab director and senior consultant in a head and neck pathology and clinical biochemistry, Tohana Mangalam Diagnostics in Punjab, or is it Haryana? Okay, sorry, he'll tell us that himself. He is it's rare, but he is an NABL approved authorized signatory for lab reports. So let's add him to the stream. And welcome, Dr. Bowen. It's wonderful to have you here.
Good morning, ma'am. And it's really wonderful to join your talk. And I really thank you for giving me the opportunity to share my views uh, for the
Entirely our
upliftment of oral
pleasure.
pathology. Thank you so
Absolutely.
much.
Entirely our pleasure. So I can see that everyone must be waiting. So let's not delay. Let's get on with it. So the
Yes.
first thing I want to ask you is, you are the director of a diagnostics lab. That is not saying oral pathology practice. That's a diagnostics lab. So there's a little bit of difference there. So first and foremost, I mean, I know you have a lot of achievements. You have all the publications, the research, in spite of being in private practice. And you are a very active oral pathologist and very proud oral pathologist. And I'm really, really happy to have you here. But let's start from the beginning. So, how is it that you have managed to set up a diagnostics lab?
See, ma'am, my current designation, you know that. and I am the lab director and senior consultant in head and neck pathology and clinical biochemistry at Tohana Mangalam Diagnostics. So, for achieving this, it took me 6 years' time. I have to go back 6 years back and tell what how it started. Ma'am, when I finished my PG, I was also very much nervous that what I'm gonna do. So many things were there in my mind. I had a good number of publications, so I was thinking that I should apply for for a publication house job as an editor, or I should join some research, or as a consultant in some cancer center, or even academics. I have an option to join academics in Nepal. They were paying me decent amount. So, but it was there in my mind that I cannot survive, because seeing the situation, I got an offer in India through some agent in some part of India, and they were paying me very meager amount. So it was clear in my mind that I have achieved something and I am not going to work below that. That was my first thing. That confidence was there that I'm not going to work below that particular amount. Say for example, if somebody was offering me 15,000 or 20,000, I decided that at least when I join it should be above 50K, because see, that
Okay.
is a very important
Right.
part of the life. Nobody can ignore it. Is a unknowingly known fact for everyone. Everyone wants a decent life. Whatever we read, whatever we do, we want a decent life, and for that we require money. Okay, ma'am, that's a alag different perspective. Even I should tell you that I was thinking to join some insurance company also to support me. So those were the worst scenarios I used to think. So what happened? I came to my hometown after finishing my PG, and before that I went to Mumbai. Immediately I finished my exam. Next day I took the train to Mumbai from Mysore, and I went and met Dr. Anita Borges because she was my mentor. I really acknowledge her teachings and her guidance, and she has played a very important role in my life transformation. So she told me that you, Bhuvan, you can. Why don't you get into the practice for that when you have so much confidence? But the thing was that even she was not sure, because she was a radiologist and I being oral pathologist. So she referred me to some other oral pathologists, and they also gave their suggestions what I have to do. When I reached my hometown, so one option was there to join in Nepal, some BP Koiraila or some Institute of Medicine in Nepal, and they were paying me around 80,000. If you don't mind, I can quote the salary part, or if I'll make it a decent one. Okay, I'll say that in that way. So then one of the secretary in IDA, I met him. He was good friend of mine because I was a member of IDA also. He told that why don't you join some center, because I met him and I wanted to start up my own oral pathology lab. So he told that instead of starting from the beginning, why don't you take some experience and join somewhere? So in my place, there is a diagnostic center with the name of Mangalam Diagnostics. It is a center, it's a chain of center now, diagnostic centers with all the modalities: pathology, biochemistry, molecular pathology, microbiology, radiology part, even nuclear medicine we have. So I just took the appointment from the CMD that I want to work under your domain, and I have done this qualification. I took my CV and I got the appointment at 9 p.m. I still remember, on 10th July 2016. So then he saw my resume and he told that if you're really interested, then you come and take an exposure for the other modalities like hematology, serology, clinical pathology, because those were the things which we have read in our DCA curriculum and in our practice. So I worked there, and he made my mind by seeing my credentials and my hard work, and he told that we have a new center some 20 kilometers away, and I will appoint you there as consultant oral pathologist, and you monitor. Along with that, one general pathologist was also there. So I did that. So it was around 11 months I practiced there. And after that, he has an impression in his mind that he want to expand the centers. So we had just two centers, and then I started establishing another centers from the scratch. So one center which is 90 kilometers away in the Gene City, I established that first center. Then Bhiwani, then Tusham, then the last one is Tohana, which I came. In 2018, I established that center. And I have been practicing the general oral pathology part and the general pathology part uh, in my routine practice. And in 2022, when we got the accreditation, so NABL has approved me as the authorized signatory for lab reports. And my scope is hematology, clinical pathology, and infectious disease serology and microbiology. Along with that, I do a lot of FNACs and histopathology part also. So that was my journey. So during that journey, what happened, ma'am? Initially, I was not given that importance that I can sign the reports. Now the question comes about the signing. So I was supervising the things, I was doing the things, but I was not signing the reports. So when you're not signing, see, ma'am, we have to understand the fact that why signing the report is very important. Because when you see a slide, or when you have done some investigation and you authenticate it and you sign, then you have the credibility for that. You are liable for that. So for that, I had the confidence. What I did, I was being criticized by so many people that you being oral pathologist, you are working into this. So what I did, they used to tell me that nowhere it is written that oral pathologists they cannot sign. See, nowhere it was written that they can sign the reports. That oral pathologists can sign the reports. Nowhere it was written. But in my mind, it was there that where it is written they cannot sign the reports. See, understand these two terms. It was not nowhere it is written that they cannot sign the reports. So what I did, I started the RTI. RTI is Right to Information 2005. It is a legal right of a citizen. So my first RTI was I filed it in 2015 when I was second year PG, ma'am. As a PG, I filed a RTI to DCI. So in that, what I have asked that kindly mention the scope of oral pathology. I have enumerated the list of investigations, and the reply I got, I still remember that the information which you have sought, it requires the interpretations of the acts and regulations of Dental Council of India Act or Dentist Act 1948. So the story closed. So it was there that time. So now after that, I saw the DCI curriculum. See, I should tell you, ma'am, DCI MDS regulations 2007 and recent one 2017. They are published by the Gazette of India. So that is a legal document. Whatever is written in our DCI curriculum is a legal document approved by the Government of India. So first thing is that whatever is written in that, anyone can practice that. Nobody can stop you from that. Then what I did, I started filing. I selected the colleges, the colleges with oral pathology department, and I started filing RTI to those colleges. So I should tell you the story that I filed RTI to 46 dental colleges. Out of that, 24 government colleges were there and 22 private. So 24 government colleges, we all know that we are signing CBC reports, we are signing Triple H reports, we are signing histopathology reports, we are signing so many other things. But when it comes to the practice, everybody keeps mum. So nobody's going to reply me at that moment. So what I did, I took the legal way out. So I got the proofs, and I have the proofs. It is available on my website and on the public domain. It is available. And what private, because my focus was for the government colleges, because whatever is going in the government colleges is directly under the control of government of India. When in a college a CBC report is being signed for a tooth extraction and signed by a oral pathologist who is a approved person by DCI, can they tell that the same report is not going to be valid in a medical college for abdominal surgery? That is my question to the audience. Then to the private colleges, I should tell you that 9 colleges didn't bother to reply me at all. And I should tell you that when you file a RTI, you have to give the reply within a month. That is the rule. 5 colleges they gave negative reply, and 7 colleges they gave the positive reply. Everything is available, and the reason was there that it was all related to the scope of oral pathology. In the replies, I have asked in detail what all investigations we can do or going on in the department. So they have given me that all hematological investigations, all cytological investigations, all biochemical investigations, all histopathological investigations, what all cases they are reporting, IHC, ultrastructural cases, and PCR. So I got this thing. So I was very clear in my mind. Then again, what I started, because see, then I started meeting some of the lawyers that this is the thing, and I'm not able to sign the reports and all. So they told that if such thing is there, then you can file a writ petition by the name of mandamus. Mandamus is that writ petition in which when two laws are contradicting each other. See, DCI says you can sign. I should tell you, ma'am, I'll read the 2 points from the DCI syllabus. The DCI revised MDS course regulations 2007, published in the Gazette of India Extraordinary, Part 3, Section 4, page number 87, under the subject of oral pathology and microbiology. The first and second objective says to train a postgraduate dental surgeon so as to ensure higher competence in both general and special pathology dealing with the nature of oral diseases, their causes, processes, and effects. Ma'am, this is a very important point. They have mentioned general and special pathology. An oral pathologist is expected to perform routine histopathological evaluation of specimens relating to oral and perioral tissues, to carry out routine diagnostic procedures including hematological, cytological, microbiological, immunological, and ultrastructural investigations. And read that curriculum everywhere, hematology, other things, everything is written. Then I compared the curriculum of MDS oral pathology along with MD pathology. So it was almost same. The difference comes in histopathology. And now what edge as oral pathologists we have? We all remember that oral cancer is the third most cancer or the malignancy. It constitutes approximately 30% of the malignancies. And the irony was that no cancer hospital has employed oral pathologists as one of the consultant. Why is it so? When we are exposed to see something which we got to see a lot, and general pathologists intervene in that, then why we have to lose our right for that? And in my practice, I'm seeing 65% of the cases which they come to my diagnostic center are from head and neck region. I have a survey, I can show you the slide for that. So that was the thing, and some other things also I explored, ma'am. Like I saw the NABL site. In that, everywhere it was written, or during that time in 2018, the Supreme Court ruling came that only MD pathology can sign the reports. It came, and see, I should tell you that health is the the responsibility of the state. It is not this responsibility of the central government. So every state has a different thing which they have to follow. So in Haryana, it came that MBBS can sign the reports. So I was making my mind when how much an MBBS knows about pathology to sign the reports, and we being a postgraduate people with full training of 3 years, we are not able to sign just because we are dental people. That stigma of dental, I really don't like that, because see, I should tell you that dentistry is a part of medicine. It is taught under medicine in part 3 of MBBS curriculum. It is available on the teaching guidelines 1998 regulations. And oral pathology is a branch of dentistry. So, in turn, it is a branch of pathology also and medicine also. So that was my understanding, because I tried a lot exploring that somebody should write me and give that they can sign. So what happened then, I started writing NABL, because my diagnostic center, the main diagnostic center, it is NABL and NABH accredited since 2016. So that time, what I did, um I wrote letters to NABL that kindly consider MDS as one of the qualifications, because NABL has considered MSc and PhD people who are non-medical people. They have considered those people to sign the reports with certain amount of experience. So I have written to them also for that. Then I have written letters to Ministry of Health and Family Welfare in 2017, and they have considered this thing. They have written in two of their meetings that doctors with MDS oral pathology, they can sign the reports, and they can be categorized as per basic, medium, and the advanced labs. And in 2018, the Clinical Establishment Act came, and they have asked the suggestions. So what I did, I gave them suggestions. I have written, but till now they have not included MDS in the Clinical Establishment Act. They have included MSc Biochemistry, MSc Pathology, MSc Microbiology also. But they have written one clause that if a specialist person is required for any specialized reporting, that can be hired. So in India, you will not get a complete comprehension, or somebody will give you that oral pathologist can sign. It is, you have to take the words, and if somebody stops you from doing that, then I have the RTIs, ma'am. 46 RTIs which are being signed by our senior oral pathologists from different parts of the India. Those are the legal documents. If somebody will come and challenge me and stop me from doing that, then I'll say that first go and stop the investigations from those dental colleges, then come to me. So that is my brief stand. And any other question which you want to ask, because there are so many things I can tell. Or if you can put up some
That's true.
slide, I can tell that also now.
Okay, now we'll leave the slides for now. But all right, first and foremost, a lot of everyone in agreement. This is the last one, so there were a lot of comments. But so now, like I said, any career success is two things: is it doable? Is it viable? So now you have shown us that it is both. It is doable
Yes,
and it is viable
and it
also.
is
It's
viable.
viable, you can
Yes,
have a good enough earning, and it is
yes,
doable
yes,
because we have the legal, the moral, the ethical, the educational, professional right to do it and ability to do it.
yes.
It's inherent within our training. But I really liked one point that you mentioned is that when you started, you went and got some training by working in the lab.
Ma'am,
Now,
I it was just 20 days working, ma'am. My CMD wanted to
okay,
see that whether I'm
see it.
capable or not.
Hmm.
He is my mentor. He has taught me the routine things. Dr. G.R. Gupta, I want to acknowledge him right now here. So he just saw that ability in me, and he just gave me a brief exposure about hematology, about clinical pathology, about serology, how, but that brush up was there, only a brief brush up was there, otherwise the knowledge was there beforehand. And learning, ma'am, you know that it is a ongoing process. Till my last breath, I have to learn the things. So
No, that is true. So what I was trying to say is that like of course things have changed a lot. Say from when I finished oral pathology, which was back in '97, it is very
yes, ma'am.
different now. A lot more of actual practical work happens with those who are learning. The
Yes,
students actually get a lot more hands-on and actual work in all the fields. But like when I finished, which like I say, it was a long time back, but I made it a point. The first thing I finished, I got my degree and I went and worked with a pathologist who was a very successful pathologist in Belgaum. And I was with him for almost 6 months. Okay, just the day to day things. And it helped that, of course, we were family friends. So he would accept that I go and join him. But the thing, what I feel is whether you get it during your, your course now, or if you have not got, or you find there is some part which you haven't got sufficient amount of training, then I think it is each individual's choice, and
See,
each individual should make it a point to go and learn. But that is
ma'am,
not a reason for not doing it at all, is what I'm trying to say.
yes, yes, that
This
is
is where
correct.
I'm going with it.
See, what,
Just because there's a small gap, it's not a good enough reason not to do it.
ma'am, what I have comprehended from your question that you want to ask that what all trainings I had during my PG and what I have learned afterwards.
Yes, we're getting to that.
Am
Yes.
I right?
Yes.
Am I right?
Yes, you
See,
can do
ma'am,
that. Yes,
I
that is
have an
also good. Yes.
exposure. I have an exposure of good amount of histopathology. My department, my JSS, I did from JSS Dental College and Hospital Mysore, and my PG guide, Dr. Usha Hegde. She was my mentor, and she has taught me histopathology, cytopathology. She even taught me how to write the articles. I have a lot of publications with her. Thanks to her and through this platform. And Dr. Prem Lata, she was really motivating for me. Every time she was in support for me. So what I want to tell that during my PG, I have learned at least 60% of the work, which in a practice you can do. Because what is written in the curriculum, because from the day one, what I did, I started reading my curriculum daily. So that was my thing that I used to do. So FNACs are the one which I have not done, not even a single FNAC I have done during my PG. I want that FNACs should be included as a part of our curriculum. In some colleges they are doing, but most of the colleges they are not doing. Because head and neck lesions, whenever a person who comes to a lab, whether it is in North India, South India, West India, or East India, the bulk of the pathologies will be from head and neck. And here I think it is the right time to tell the data. I should tell you the data, ma'am. Since 2018 and till today, approximately 1420 FNACs I have done in my center, the present lab. Apart from that, some 1,500 will be there. And I should tell you the head swellings constitute 20%, whether it is preauricular, infraauricular, submandibular, submental, supraclavicular, scalp, temporal, infratemporal. Now just tell me that is it not a part of oral pathology? I want an answer. Then neck swellings, 29% are neck swellings. 3% parotid swellings, 13% thyroid swellings, and the last ones, all these constitute 65%, ma'am. This is the archival data which I have from my lab. And then breast lesions are 27%, and axillary and other lesions constitute some 8 or 9%. So in that, what all cases I have seen, I should tell you, ma'am, lymphadenitis, tuberculosis. India is full of tuberculosis, metastatic carcinomas, squamous cell carcinomas, epidermal inclusion cyst, thyroglossal cyst, lymphomas, silidinitis, pleomorphic adenoma, mucoepidermoid carcinoma, adenoid cystic carcinoma, acinic cell carcinoma. So just tell me, are the things which I am talking, or if for thyroid, colloid goiter, nodular goiter, maybe we are not trained for thyroid, but you see the curriculum of American Academy of Oral Pathology or British Society of Oral and Maxillofacial Pathology, they have included thyroid and ENT pathology as a part of this thing. And we are seeing lot many case reports in different journals on day-to-day basis. So these are part of head and neck pathology.
Very
So
true.
I think I conclude with my this study which I have said, ma'am.
Yeah.
Any other questions or any other
No, so
clarification which
basically,
you
one
want?
thing is very essential, I think, is that uh, right from the beginning. I mean, part of the that is not success only in oral pathology, but in any field. Part of the whole
Yes.
success depends on how good you are at it. So that being good at
Yes,
it
that is.
also is essential. It's essential. I mean, it is essential in oral
I
pathology
should
and
tell
in
you for that.
everything
For
else.
that, I should tell you, oral pathology was my first and last choice. I got oral pathology in abroad in University of Alberta. I was getting MS oral pathology because of my family obligations. I could not go there, and it was my first and last choice, I should say. And I did it with my full passion. That I used to tell you once what happened. I prepared a Maggie and I put some sauce pieces, and in my mind it came that it is a picture of peripheral ossifying fibroma. Can you believe that a person who is so
Yes.
mad into the subject? See, I am not saying that you become mad. See, it varies from person to person. See, it is for the postgraduate students. See, those who have taken the subject now, my take home message will be there. Please do justice to the subject. If you're not passionate, at least like the subject or love the subject. And if you cannot do that, please leave the subject. And it is for
True.
any branch. It is for any
Any
branch,
branch.
any damn branch, whether medical branch or the pathology branch. And I must say that I have seen the medical counterparts also. If we have some kind of this thing that MD pathologists are so great and they can do anything, then please don't remain in such kind of misconception. I'm not against any kind of thing. It is, the competency is subjective. Everything is there in the curriculum. It is how you have done that matters. And if you keep on saying that we are not trained, we were not trained, that exposure is not there, so nobody will come and fetch you water and make you drink that. Where
That's
there is
what
a
I
will,
was
there
saying.
is a
Getting
way.
exposure is something that is easily, what I would say, is easily achievable. So depending on what
See,
each
that was the
person's
thing, ma'am.
requirements
I
are,
should
what
say.
are the lacunae that each person may feel they have in their own. Each person should be able to judge their own training more than someone else saying. So if I find that I have, there is this
Yes.
area I'm not very good at, it's up to me to get up to the mark there. It has, I
Yes,
mean,
yes.
that, and that again
No,
is with
I
every
should,
branch. It's not an oral pathology thing.
I should tell you, ma'am, my parents, they were not interested that I should take oral pathology as a subject. They were like that you do a clinical branch, either oral surgery or prosto, they were. So I have done all the subjects with, I have passed all the subjects in my videos with fairly, I have done well and I have passed with good colors. But it was not my liking. So I told them that if you force me for that, I am not going to do well. And if today, in some burden, if I would have done that, then I would have been the worst prosthodontist ever made, I should tell you. And today also, I don't say that I am a very great oral pathologist. My message to everyone is that when I can do, anyone can do. That is my main intention to all oral pathology community, that please understand your potential. India is full of scope, because ma'am, as in your article I have read that a salesman went to a place and they saw that they do not wear, they don't have shoes. So one person said that there is no scope at all, and another went, he said that it is full of scope because nobody has shoes. So now you see that India, actually, to be very frank, I am linked with the diagnostic industry. It is lack of qualified lack of qualified workforce for lab professionals, and oral pathologists, they constitute a good workforce for that. So it has enormous opportunities. If not practice, then other things can be explored. They can get into lab administration. They can get into quality part, quality managers, their courses, and somebody wants to have a guidance for that. I am ready to help that. I have established 10 diagnostic centers. Even pathology people, they take my advice for that. So why I will not be able to give advice to my own colleagues? So
Very true.
it is
Yes,
full of opportunities. It is how you see whether the glass half filled or half like
that is
empty.
always there.
So
Okay, let's
yes,
take some questions, Dr. Bhuvan. So the first one, of course, we had a lot of comments of everyone saying great journey and great work. Now we have some little questions. So one is from Dr. Rajasekhar, who says, "Sir, if MDS oral pathologist not able to sign, then what's the use to do MDS in oral pathology?"
there is no use. That's what I am fighting for. Oral pathologists can sign. Who told that they cannot sign? I was the one who was speaking from the beginning. If you have to raise this subject, make them signatory. And who told that they are not signing? You send me personal mail to me, then I'll show you that in India, nearly 50 colleges they are signing the reports. That's what only I'm telling. That if a oral pathologist is signing a blood sugar report or a triple H report, will it not be valid in some other place? And just tell me why it is not valid. I want an answer for that. See, raising some question is very easy, but we have to look about it, what it is for.
So to put
And
it
that
in
is
very
actually
short, Dr.
happening.
Rajsekhar, is you are able to sign. Let me just wrap it up. You are able to sign. Oral pathologists are able to sign. You need any proof, anyone questions you, all the details are there. I have given the link to Dr. Nagpal's LinkedIn and also his website. So all the detail is there and you can get in touch with him. So let's go to the next question. Okay, Dr. Vivek Gupta. Sir, I have been told that oral pathologists can only do routine lab work like hematology, etc., or any other test, only when it is referred by a dentist. Yeah, this is something that is
Yeah.
going around a lot. I have to
Yes,
say, even
yes.
I've heard this. Yes.
I'll tell you, ma'am. I am prepared for that, and I have written letter to NABL. I'll just get that thing. See, ma'am, what my friend Dr. Vivek Gupta has asked, that he has been told that they can do lab work like hematology, etc., or any other test when he is referred by a dentist. This clause came by NABL in 2018. What they have written, that an oral and maxillofacial pathologist can sign histopathology, cytopathology reports, and hematology reports. In that, they have mentioned HB, BTCT, ESR, only referred by dental professionals. Now, after the first of all, this stand by NABL is now nullified. It is no more valid because Clinical Establishment Act 2020 has come into the force. So after, when they have written this thing, I have asked the explanation from NABL, that just tell me, if a ENT person sends a histopathology to a oral pathologist, then what should be done? If a dentist sends a cyst sample to a general pathologist, will he sign or not? It is all rubbish what they have written. It cannot be accepted at all. And moreover, NABL is a autonomous body, ma'am. It is not a body which governs us. Ours is governed by DCI. Even if somebody files a complaint to MCI, they will refer it to DCI. I have done that. I have asked a question, that that MDS oral pathology comes under preview of what they can sign. Then MCI has diverted that letter to DCI. So now this thing has already nullified. You can check on the Ministry of Health and Family Welfare 2020. In February 2020, the new regulations have come, and in that, such thing is not there. Even NABL has removed this thing, so it is no more valid, I must say. And I have, what mail I have for that, defending those things, that I can tell, if you give me, permit me some time. Uh,
You want the slides? I brought the slides. Which slide is it on?
No, ma'am, it is not the
Oh, it's
slide.
not there. Okay.
I have.
Actually, they can find it in your on your website. I don't think you need to. Does anyone want to actually hear exactly what the email said? So let's see, we have in the meanwhile one more
Ma'am,
question.
and I should tell you,
Hmm.
that when you go to the DCI website, a BDS can sign death certificate. They can give age estimation certificate. Is everybody aware of this thing?
No, I don't think so. Yeah, I
Then
guess
why
death
can't we,
certificate, because that's why they can also sign the. I mean, they can also stand
ma'am,
whatever
forensic
report
odontologists,
for
we talk
forensic.
about
Yes,
forensic odontology. If we are not able to sign and give that the perpetrator is from this age or the victim is of this age and sign. See, signing is very important because you have
yes,
authenticated that thing. That's why you are signing it. So when you are signing it, when a BDS and MDS can sign death certificate, it is available. Go open the website and see, can show the screenshot for that. And the Dr. Vivek, what question he has raised, I have a proper email. I'll forward to you. I have a reply for that, and I have forwarded to NABL. I never got a reply for that, and now with time it has now nullified.
right. So we have one more comment, I guess, from Dr. Jyotsna. Dr. Bhuvan is fighting hard for getting the signing authority. If all the older pathologists come together and fight together for the same thing, puts on RTI and make government understand about this. Well, I would think that already the government has understood, because now it is possible thanks to all his work. Uh, However, if I think there are other things we can definitely do, and maybe we can move and get additional permissions or additional recognition, whatever is required. Let's see, Dr.
Ma'am, it is
Garima,
already
head and
there.
neck. Exactly, that's what I said. Permission is already there. Head and neck FNAC can be done without any guided imaging. Hence, most can be done manually. Same is the case with our center. So, Dr. Garima, they are also doing it in their center, which is nice.
Dr. Garima, ma'am, I must say she is a very good oral pathologist. I know her, and she is also one of the examples. She has joined as junior consultant recently after completing head and neck pathology fellowship from Dharamshila Institute, New Delhi, and she is working at par with MD pathologists. Even Dr. Deshant Agarwal, he is working as a consultant in cancer center. Maybe they are not doing the other parts, but they can learn and start doing. What is so big deal in that? When MD pathologists can do, and it is there in our curriculum. See, what I am talking is based on the facts which I have, ma'am. What I am saying is not that I today I got the dream and I'm just telling all those things. It was just that a new change, people never accept it very easily. You have to make them understand. One thing, ma'am, you are doing, you are promoting the subject, you are creating awareness. Hats off to you. And definitely it will, one day it will become the choice.
True. Okay, let's see what else we have. Dr. Sahana. So, there are certain government funding schemes for cancer patients, but most of them mention oral pathologist signature is not valid. What do we do for that, sir? Okay, I was
Sue
not
them,
aware of this.
sue them, sue them.
True.
I have answers for every of your questions. You ask me anytime question because 6 years I have worked like I know what all typical, and I'm being a medical legal expert also. So just tell me what the things they want to ask. See, you have to take the stand for that. If they have not accepted yours, so then file a case.
Yes, and
Keep
I
a
think
trust
it,
on
it
the.
cannot have a standing, because it's finally the DCI who recognizes us is a government body. So how can then government say that we cannot
Ma'am,
they cannot recognize us?
see,
That
I
doesn't make
have the
sense.
proofs. I'll tell you, or you can just put a slide, ma'am, if it will be easy for everyone.
There you can, which slide number, you can just go to your slide number what you need. Yeah.
See, ma'am, this is the one. NABL has approved after the application that they can sign, but they have added a point that only referred the cases referred by the dental people. But Ministry of Health and Family Welfare, they have written. You just go and type whether oral pathologists can sign the reports or not. You will find the meetings, the suggestions by the Clinical Establishment Act 2012. See, this act got amended in 2012, then 18, and now 20. So I have written letters and they have clearly mentioned. I should tell you, ma'am, or this was the my experience which I have told what all spectrum we have, and who sends me the cases. ENT people, general surgeon people, ortho people, orthopedic surgeons, oral surgeons, dental people, dermatologists, general medicine, pediatrician. How does it matter, ma'am? If now you tell me one thing, if I ask, now NABL has written that that oral pathologist should sign the report, the only of those investigations sent by the dental people. Okay, if a dental people refers a case of fever or leukemia to a medicine people, will that be a crime? Or if a medicine people sends a patient to a dentist for a referral or for dental pain or some other problem, will that be a crime? I think it's utter nonsense which is there. I hope
True.
the audience agrees with me with that.
Okay, now I have one question since you have shared this. The blood tests I can understand because yes, like you said, if sugar is high, sugar is high. It doesn't matter where the lesion is. But what about say cytology, FNAC, where you need to know the original pathology to understand the pathology, the picture of the pathology to be able to interpret it. So since we do not really do general pathology to
FNAC.
the same extent, yes. So then how are you reporting those?
See, ma'am, in that I am a co-signatory with another general pathologist. I have learnt a skill to report. What I do, I write my opinions and for the head and neck regions, and I take opinion from other general pathologists also. For that, I am signing that. Even he's signing, I am
Yes,
also signing.
perfect. So
And
basically, I
in the
just wanted to
initial,
clarify before anyone misunderstands.
but
You
I
are
am
basically
signing
when it comes, you are
only
exactly head and neck.
I'm signing only the lesions which are pertaining to my domain. See, I am not
Ex-
trained to report prostate. I'm not trained to report large intestine. I'm not trained to report uterus. I'm not trained to report gallbladder. So I'm not talking
Sure,
about that. You leave that. I'm talking only about the head and neck part, which is 65%. And for that, at least we should be given. And
definitely.
people should be, see, if by that, the opportunities will increase and people will have a decent life. You know that I don't want to talk on a negative note. Everybody knows the scenario of oral pathology, how it is going on in the country. But I should tell you, it is not so only for oral pathology. Many other branches are also there.
True. Okay, we are running towards the end of our time, so we'll hurry it through. So Dr. Gupta says, sir, then can we open an oral pathology lab like a general pathologist and work independently?
Yes, of course.
Yes. Okay,
Provided
Dr. Nasser.
you are competent and you are fully confident for that. Go ahead for that.
Yes. So Dr. Nasser says signing is something and detailed interpreting of autopsy finding or hematology complex work is another. That is true. As far as the autopsy goes, of course, we are only talking
See,
in
I am
terms
not
of
involved with autopsy, ma'am.
yes, autopsy
I have done a
exactly.
lot of forensic work, but now I am into the general practice of oral pathology and the
True.
routine practice. And wherever you have the problem, you have the right to take opinion from others.
Take a second opinion. Yes. Okay. So Dr. Arora says, hello, sir and ma'am. Dr. Bhuvan, sir, only if you will be able to recall, but I took your advice when you were in Hisar as I was planning for oral pat. Now I'm a first year resident walking in your footsteps.
Thank you so much.
That's very
And
nice to inspire
please
someone.
be firm. Please be firm on your, and it is a good branch. Work hard, develop your skills, develop your competency, And for postgraduate students, as I've already said, that please join the subject with passion. And if not, you are being forced into it, at least like the subject. It's a good subject. Otherwise, if you don't have any interest for just for M factor you are doing, because nowadays people are doing for M factor also. Please don't do that. And please develop confidence by reading the curriculum, develop those skill sets. So that is there.
Yes.
And
Do
there
we
is no
have one?
shortcut to success, ma'am. They should understand the curriculum and implement into the practice. We have emerging branches like clinical biochemistry, microbiology, and molecular diagnostics or molecular pathology.
Very true. So Dr. Diksha says, Dinsha, hello sir, what are the choices for an oral pathologist to work in a molecular diagnostics department after taking the basic
Enormous.
training in the field?
Numerous. I got during the COVID time. I was the one who started the COVID department in my diagnostic center, and me and my wife contracted COVID because of that. And she was expecting I should tell you. It was
Oh,
a part of the other story. They can, yes, you can do. And I have a name of a oral pathologist. She was reporting the PCR reports. She is working in Indore, Madhya Pradesh, and she's signing the reports. And she's MDS oral pathologist.
totally. Okay. So I think we have almost everything covered. And with that, we should call it a day and wrap it up. It was a good amount of information, and all that information is also available on Dr. Nagpal's website. Anything you want, you can get it from him. You can send him an email. His contact is there. He is on LinkedIn. He is active. You can connect with him. And of course, his email is also there on his website. So you can definitely connect with him anywhere you choose to. And he is really making an effort. Okay. Now, since I normally it's my habit of not reading long CVs. So I did not read that, but there's a lot he has done. A lot he has done, right? Probably from when he was a student, like he mentioned, up till now, and he's constantly working to upgrade and to improve the status, overall status of knowledge, learning, and patient care. Because all of it goes hand in hand. There are no shortcuts, which is something we have always said on the channel. Please remember there is absolutely no shortcut. I remember this from when I was teaching, that even to my BDS students, there was sometimes I'd say, "Oh, ma'am, that's so much." I said, "Who told you it's going to be easy? Did anybody tell you being a doctor is easy?" No, I think almost everybody would tell you that there's a reason doctors get that much of respect is because what we do is tough. Training for it also is tough. And then when you're going to do a master's, it gets that much more tough. And you need to really put in your whole heart and soul in it. Do the best you can. You need to be that good. And once you're that good, no one can ignore you. Really, no one can ignore you. You will get ahead.
Ma'am, if you permit me, I'll just want to
Yes.
show some three slides to the people, to the audience, if you allow me.
Okay. And then we will wrap it up soon.
Yes,
Okay.
yes, yes. I have this question to everybody. I'll give the answers. Now everybody should decide. And if they have some better option for that, please tell me. I'm searching from past 8 9 years for that. And I must say that allow your passion to become your purpose and it will one day become your profession. So I am working on that. And to the postgraduates, please, excuses make today easy but tomorrow hard. Work makes today hard but tomorrow easy. The choice is yours. So thank you so much, ma'am. And
Most welcome.
really,
And yes, here is your little certificate for having
thank you so much,
contributed
ma'am.
to the channel.
Yes,
Yeah, most welcome.
and
It was a
I,
pleasure, Dr.
yes,
Bhuvan. It was really nice
and
having you here.
yes,
Yeah.
and you can share my email ID and contact number. I am always ready to help the postgraduate students and other faculty and other people who are our colleagues and friends. And please work hard, and don't have this kind of negative mindset or inferiority that you cannot do. The opportunities are so much, and you we can prove ourselves if we put a lot of efforts. It's just we have to understand our potential strengths as oral pathologists. Thank you so much, ma'am.
That is very true. You are most welcome. It was a pleasure having you with us. And
Thank you, ma'am.
I don't know if I should say it or is it a hidden thing, but okay, I'm going to say it. I'm sorry if you were not meaning to share this, but Dr. Bhuvan is all set and is working on starting a course. So those who want to go and get trained with him will be
Okay.
able to. Yes. So he is almost there. The information will be out, and once it's out, even I will share it on the website, and I will share it with you all in our newsletter, so you are well aware. And
Yes.
yes, you can go and join him and learn from him. That is so, with that, we will wrap up and thank you, everybody. So, next week, we are going to have a recorded session on uncommon fungal infections from Dr. Yamili Rui Vasquez from South America. And well, I hope you will definitely watch it and you will enjoy it. And please do remember, if at all possible for you, in whatever amount you can, make your contribution, whether in the live chat or whether as going and putting in the super thanks. And if neither is possible for you, definitely at least share the content, because that's how we get across to more and more people. Finally, it is all about promoting oral pathology, and that's all we do. So that's all. Thank you so much, everybody. Have a
Thank
wonderful,
you so
wonderful
much.
week, and we will see you next week. Take care. Bye.
Yes. Okay. Bye.
Bye. Bye.